Hi, good afternoon. This is Iras Hi back again with a great review of the dLife Diploma Course in Lowcarb Nutrition and Metabolic Health. My name is Iras Hi. As I said, I'm a metabolic health coach based out of Mumbai. I'm a dLife member, also its media head. I have with me Karun Kathuria, who is also a dLife member and a certified metabolic health coach now based out of Delhi. He has completed the dLife Diploma Course in Low Carb Nutrition and Metabolic Health. He's a computer engineer by qualification, has worked extensively in the IT sector for 10 years, including Infosys. He's running a banking BPO service firm now at Delhi. He's passionate about long-term equity investing and analysis and also health and nutrition. Welcome, Karun. Welcome to this new episode of Course Feedback videos. How are you today?
Thank you so much, Ira. Good afternoon. I'm doing good and looking forward to our conversation.
Yeah, very interesting background. In from the IT to nutrition. How did you make the jump or the leap into nutrition? What were the reasons for you to study nutrition?
You know how the IT hours are, and my body was getting impacted. And there was one point of time when in Pune, the doctor on the prescription said, lose weight, start exercising, and quit smoking. You know, you were working long hours, but I never knew that, diet is connected with these problems, because in normal world, you get to hear that you should exercise more, you should sleep more, or you should starve yourself, maybe,
Eat
uh,
less, move more.
yeah. And because we couldn't do that, so I was like, okay, one day we'll get around to doing that, but it's much later, I heard about this term called fatty liver and then started to research about it and still no progress, but there were these tidbits, you get to hear eat more leafy greens, eat more fruits, eat more vegetables. That was it, and nothing was working. Okay, there was no mention of grains anywhere, for example, no mention of seed oils anywhere back then. It's just before the lockdown in 2020 I got introduced to some Eric Berg videos, and then through Ken Berry and Robert Lustig and all that domain. And then the lockdown happened, couldn't order non-veg. And so it's been off and on since then. I've been reading, practicing a little on myself, but then suddenly one of the family members got diagnosed with cancer, and I could see that he was following a high carb diet, and you know, so I started those interventions, and then I was following certain people on Twitter, including Anup and Shashi and some of the people. Now I know they were dLife members. Back then I did not know. So while I was making that intervention, I frantically reached out to Anup because I needed a keto mojometer to measure his level of ketosis, and I was not getting it in India. So he helped out, and then he helped out with um, what can be done with respect to diet. Like I never knew virgin coconut oil is also safe. I was more into full carnivore, okay, full ketosis, full carnivore. It's only after his cancer started to go into remission. It was metastatic. He had only 2 months to live, and he recovered completely. Started walking. His bones started to get formed again. He lost a lot of weight also. We started driving, going to work, and it was magical. So then I contacted Anup and I said, okay, I want to do this course, and I want to learn more about it in a structured way, because you do your own research, it's very unstructured. You're focusing on one problem, you don't know the entire gamut of things, and that's where this course helped tremendously. It's so structured, it covers every damn thing. You name it, the vitamins, the minerals, the supplements, the basics of nutrition, and what happens in one particular metabolic. See, for me, the biggest breakthrough was when long back, I learned that insulin resistance is the root cause of so many problems. Be it kidney problems, heart problems, stomach related GI tract issues and stuff. But still, my knowledge and research and learning was very unstructured till I joined this course. So yeah, that's how I came about to joining it.
So I think we pretty much answered why and how you came to join dLife. While you were looking for courses in nutrition and metabolic health, did you find anything which got your
So
attention?
so for me, it was like whatever learning I did through on my own, I was trying to make interventions with, family members and colleagues and friends. Like there was this case of PCOS, I kind of put that into remission. There was this cancer-related 5 cases. I've been um, providing suggestions to them. Then um, cholesterol, heart disease, 2 cases of that. But then I thought that, this is all in suggestive mode. I needed some backing where I could say, okay, there is a certification, there is a proper training that I've gone through, and then I could go out boldly and start those interventions um, instead of just saying, okay, I'm suggesting this will help and that will help, because you can't boldly do that because you're not trained professional as such. So yeah, because I got in touch with Anoop on Twitter, so I didn't look for any of the courses, and I think now that I've done this course, it's fairly detailed. I mean, course is one thing. There is this entire reference material. Okay, I still haven't been able to consume all of it. That reference material is like gold mine, because it's one thing to mug up, okay, this happens, that happens, but when you go through the reference material, there is so much of association you make with these concepts that you get grounded into those concepts. And then,
So you,
yeah,
yeah, no, I was just saying. So now the shift from suggesting things and suggesting interventions. Now you are a legally certified metabolic health coach, and you can go all out there and do the intervention with so much more confidence. How do you feel about that?
so much more confidence, and now I can even monetize it, for example, and assert assertively, make those interventions. Because earlier it was like, okay, I've read it from that book, or I've seen it in that video or that research article. But now it's like, okay, I know what I'm saying. There is a whole lot of backing to it. Yeah, that makes
So
a lot
how,
of difference.
yeah. So how did you what are the things that you found very good or very impressive in the course itself? And then also tell us how was the forum support and all the resources that you had access to?
Yeah, I mean, course is like it looks like that you're joining the course, but actually you're joining a huge platform where, see, you're not working individually. You're connected to a whole gamut of experts, in the group that dLife provides, in the platform that provides. Um, every day there is so much of research that is being shared. Every day, others who are making interventions with their clients, what they're finding, that is being shared. Even when a blood report is being analyzed, there's so much to learn, just by going through all these things. So I think more than the course has its own value, no doubt. More than the course, there's an active live platform you can connect with any moment, and there is help available, there is expertise available. So that then you're not dealing with the situation on your own. Then you have a whole panel of experts, that you can tap into anytime. And then forum also, like for me, low carb never existed. Okay, for me it was all ketosis and full blown carnivore diet. I never knew that a vegetarian option can also be taken, to put things into remission. I never knew that, for example, those protein shakes and those kind of things could also be done. I was only a mutton guy, a chicken guy, and an egg person, and I would recommend that, and would face a lot of resistance, when people would be like, no, we can't change our lifestyle, so tremendously. So with the forum, there are thousands of recipes, um, right from snacking to main meals to drinks to, and that opens up a whole lot of possibilities for various kinds of people to, tap into this dietary regime, and put their condition into remission. Which I could never have done it myself. I was like pure carnivore so far.
Karun, what would your suggestion or advice be to those people who are probably thinking of joining DLife, the doctors, the other professionals? We already have 19 doctors, as you know, enrolled with us. There are 7 IITians, nursing staff, defense personals, people like you from various professions and fields. What do you advise to those people about the course?
I think my only advice would be that there are so many strategies that work sometimes temporarily, but whatever I've seen and I've tried all my life, they all fall into the CECO category, calorie in, calorie out. You just keep measuring it. It helps for a while, but it's not sustainable. Um, Full carnivore may not also be sustainable for everybody, but yeah, low carb, I found this approach to be sustainable. It's guaranteed to put a lot of conditions into remission, even when you're not looking for those conditions. Like, for example, somebody might be looking at losing weight and their cavities would get impacted, you know. You're not even you're not even aware that your eyesight could improve and your cavities could go away, for example. So I think for a sustainable way and see, body is designed in a way that it does not need carbohydrates. This simple fact nobody knows, you know. We're all taught balanced meals and fruits and vegetables are good and stuff like that. And so yeah, my only advice would be go for it. This is the way that works, and this is the way that our body is designed, you know, to take food. Every other way, even if you try it, it's temporary. It has its own drawbacks. This is what body needs, so go for it. Yeah.
I think makes sense. I think given the background of India's metabolic health crisis and the amount of bad dietary guidelines given by mainstream associations, I think it's very important. As you said, for example, nobody told you about the grain. Nobody told you. There are so many misinformed facts that you wonder when you come to the forum and the platform that whatever you were doing was all wrong, and it doesn't fall into the low carb, genre as such. Okay, so thank you so much, Karun, for that wonderful review. I think it'll help a lot of people who are deciding to enroll or study a nutrition course in low carb nutrition and metabolic health. We have currently 19 doctors enrolled with us, 7 IITians, people from defense background, nursing staff, and accomplished professionals
And
like you.
I think I'll add something here. It's very important for the medical fraternity to also join this in some way or get themselves aware about it, because you go to hospitals. Uh, while I was trying to make intervention, I had an uncle who got a bypass surgery done, and he was being fed fruit juice, real fruit juice while he was recovering. Okay, he was being fed rotis, rice. While having a bypass, you can't be having such high carb diet. Okay, and he went into onto the ventilator, and finally he couldn't make it. So even the nutritionists in hospitals, they don't understand, low carb approach. They just keep giving a diet which is being taught to them, and in the name of balanced diet, and it doesn't help the patients. Even
Yeah, and
Apollo,
hence
big hospitals are doing that too.
You're quite right, and hence, if you are talking about metabolic syndromes with regards to low carb, dLife is the only legally tenable course in India. And so, to be a legally certified course, this is the course to be a legally certified metabolic health coach. This is the course for you. And for those who want to know a bit more about the course, we have the largest content on low carb nutrition and metabolic health in the world with 800 references, 200,000 words, 60 relevant videos, lifetime access to the course, and 6 months additional access to the forum from the start of membership internship. There is no recertification clause, and there is huge forum WhatsApp support. When you sign up for the course, you get access to the 10 years of premium curated data of dLife, which is the biggest in the world in terms of forum threads, the case studies, which are over 3,000. There are 2,000 plus original low carb, keto, carnivore, and vegetarian recipes that you can use. And there's a lot of hand holding even while you're taking up clients or using the knowledge for you or for your family members. I think we've come to the end of this video. We'll come up with more information and more reviews from those who have completed the course. We are trying to bring you a series to help you make an informed choice of why you should study low carb nutrition and metabolic health and use it for your personal advantage. Thank you so much, Karun, for joining. This is Ira
Thank
Sahai
you.
signing off from Mumbai. See you around next time.